My name is Mary Adhiambo Odongo. From Kenya, Kisumu County. Currently, I am leading the advocacy to end digital addiction among children and their parents. I started with the community engagement and stakeholders to enter into the community, since I was targeting to work with the children, but I can't do that without involving the ministry. So I organized a stakeholders meeting forum for 4 slums of Kisumu County, and that is Manyata, Kondele, Nyalenda, and Obunga slums. Forums brought together parents, caregivers, community leaders, civil society stakeholders, and the main reason or purpose to bring these people together was, number one, to introduce what I want to do in the community, and again to introduce and discuss with the parents the areas, or if at all they know what digital addiction is. The primary objective, I wanted to establish clear guidelines for children's internet use. And this would come because it's parents and teachers who always spend most of the times with the children. I was also privileged to have met in the same meeting of stakeholders the Minister of Education nationally. It appeared like it's something that is ignored, but it is there. But nobody is talking about it because they don't realize it is addiction unless somebody now starts talking about it. Most parents did not recognize at first what digital addiction is. Mm-hmm. So I had to start from introducing what digital addiction is, explaining the reason why, the meaning of addiction that is separate from just using social media the normal way. So I wanted this awareness and digital addiction elimination to be a work of collaboration. I never wanted to be for Mary or for Digital Health Education Network, because as much as we feel we have solution, but they own the solution for these children. We don't own the solution. To the community forum, they realized that the issue of digital addiction has gone beyond. It is more than what they can control at household levels. Teachers also realize that it is something they cannot control at syllabus level alone. So they needed collaborations to enter the schools and also enter the community. I had to be given permission by the Minister of Education based on what we presented.
How did that go?
I got the permission. So I asked most of the parents some of the areas they feel their children's behavior has been brought about by the excess use of screen or technology. And most of the parents say that, number one, when the children are given homework to come home, they no longer want to think for themselves. They will ask from a parent. And the other thing they also notice is that their children no longer wants to go out and play. Then another thing they also notice is that some of these children, when the light is on for studying, their time for homework, they really strain to look at the books. Being that it was a forum that involved the stakeholders, now I took it back to stakeholders. I asked them, what do they think we can do? Stakeholders identified the need for strong child online protection policies and recommended engagement with the county and national government, because we could not do it as an individual. It's something that needs involvement of national body. So from there, we agreed with the stakeholders that after that meeting, I was going to organize and meet the stakeholders of different departments, that is for health, children's department, and education at their office levels. After that, I visited education sector. It was easy with education and health because they were in the forum meeting. They made a call to heads of schools I wanted to work with. They introduced the project I'm going to do. and then they allowed me to go in. Now, I also realized that even if I will be going to schools, maybe to do the interview, maybe to do the awareness, there is a gap here. Parents still doesn't understand fully the meaning of digital addiction.
Right.
This forum was not enough to educate the parents about digital addiction.
Mm-hmm.
It was just for introduction.
Mm-hmm.
So what I did first before going to schools, after getting the go-ahead from the authorities, I organized parent and caregivers capacity building. Well, this was going to give me easy work, because if at all we educate them in school, when they get home, they also get something reminding them that, oh, it's not for school only, even at home, it is a concern. And I emphasized on the critical roles of the parents and caregivers in managing child's internet use. So, in the forum, it revealed significant gaps in parental digital literacy also. And most of the parents reported that they have difficulty in monitoring their children online, because they even don't know what the children are doing online.
Right.
They are not even aware about the platforms. So the children appears to be more literate than their guardians. On the same note, we also encouraged parents. Actually, I told the parents about encouraging the co-curriculum activities and insisting that the child goes to play outside. And sometimes you can also just discipline your child, just to tell them that the phone is not for children. The phone is mine. For a child, this and this is yours.
So let me just ask, when you explained to the parents that the children don't need to have the phone, and it's all right to take the phone away and insist that the children play outside or do other things, how did the parents respond to that?
Some parents say that it's going to be difficult because the children are already used to phones.
Mm-hmm.
That is number one. Number two, they are saying that they don't have that time to bring the child into order when they are crying, because currently they are busy. So, like when those women who are in business, they are giving me uh, a reason that, remember, you are serving a customer
Mm-hmm.
and the customer is waiting and the child is crying. The nearest thing you can make a child keep quiet so that you serve the customer is the phone. And if you also look this into reality, she prefers customer because this is what will feed this child over over maybe the child crying or even attending to the child. We have parents who are also working group. They are also addicted to phones. So even before they go to their children, they also say like, no, I'm going to start with myself, because for me, my child sees it from me.
So, as you had these conversations with the parents, and the parents,
Mhm.
admitted how convenient it was to keep the child quiet and but reflected on how they hadn't grown up with phones, did you find that most parents were receptive to the idea that, they could do something about it?
The parents were receptive and were really willing to do something about it. One of the parents brought something up that comes with the online child labor. Her daughter found it in a group.
Mm-hmm.
And in this group, the payment was quoted. This thing entered into her daughter's mind.
Mm-hmm.
She's tried to stop her daughter. Her
Mm-hmm.
daughter sneaked because the contact of where they will meet was in the phone. The girl got lost. She went reported to the police station. The police requested for the number the girl has been communicating with, because the girl was using the mother's phone.
Mm-hmm.
And this number was tracked by DCI. And these children were found in a room being used as sex toys, and somebody is taking money. This also brought the issue of living alone sexual exploitation, but also online child labor. So that is also something that came up and also awakens us that, oh, as we talk of cyberbullying, blah, blah, and all that, there is also a side here.
Go ahead.
So from From my meeting with the parents, now I moved to school. In school, the main reason why I went to school was to conduct education on digital health awareness with the teachers and the children. I engaged the teachers and I also engaged the pupils. And the pupils, I engage them through groupings according to their age to identify or to do a study on how and which ages are mostly into digital addiction. This would help me make a message for awareness. I met from age 7 to 17 years. And as a result of these interventions, schools committed to integrate digital health on their topics. They also said, since it is not easy to convince government directly to insert the syllabus of digital health, they will conduct it in their life skills lessons in school.
Great.
So this was a surety that even if Mary doesn't come for the teaching, the school will always remind the children what is required of them and the repercussions of getting more time in digital access. They also supported the establishment of ongoing health clubs. They told me that we can start from somewhere, but when it comes to teaching, we will be inviting you if you have time, because most of these things are well understood with the vision bearer. They can only use the manual. Even in our lessons, if we will be having a forum for children, we will be calling you. We will be inviting you
That's
to
great.
attend.
Yeah.
I also arranged to get a counselor so that I don't walk alone, because there are so many issues rising during the meetings, especially on digital education. But when I'm one person, it's not easy to handle them. So, in collaboration with the teachers, we documented key factors that are contributing to internet addiction among learners. We found out that increased unsupervised internet access at home and in school, this has increased internet addiction among children. Then another thing we found out was prolonged daily screen time. We also found out that there is reward-driven online reinforcement or experiences. A child is told you dance half naked, your money sent into your account.
Right.
Things like that. Teachers also noted the broader systematic challenges in children's behavior, especially on doing homework. A child comes home with the homework that is 100%. But that same child, if you ask them what they wrote that they got 100%, holding their books, they can't say. So a child passes with homework but cannot pass in exams, because in exams there is no phone to do the search. Teachers noticed that, and they said parents do complain that my child, when given homework, he does well. Why is it that my child is not passing in exam? So this is something that the parents didn't understand. And imagine, even the teachers didn't have this response until I was there. Now they were saying like, no
That's
wonder,
what's
no
going
wonder.
on.
No wonder the children get so well in their homework.
So they're not
Yeah,
learning.
no children are willing to participate in co-curriculum activities as before. Yeah, like the game balls. When it's time for games, children are just waiting for that time to go home. Some children are dizzy in class; they even sleep. And then teachers also realize that this issue of internet has brought about peer influence on the lifestyle of other children. If somebody comes with the new shoes, the other will also want to come with the new shoes. So they have to ask, where did you get the new shoes? For this digital health issue, one will ask, and then they introduce them to a platform that gave them that thing. They realize that in internet, the children are being, do you say, lured to
Yes.
give private information about their parents or homes. One child said when she speaks on TikTok, the other end of group whom she interacts with insists that show us the room, show us the room. Move around, show us the room. When is your mom around? Do you take wine? Do you take what? And after this, the home is raided and things are stolen and people are
Right.
injured.
Right.
This activity about the school I have just explained, I did it or I have done it in 3 different schools.
Mhm.
And in 3 different schools, I have made 4 lessons each.
When you are with the kids, what is their attitude toward what you're talking about with them?
They are moving with the current lifestyle. Technology is changing,
Mhm.
but their friends are doing it. You see, like, but our friends, who is telling them to leave? They are still doing it. So it is us you are coming to tell, and others are still doing it. Innocent children, like age 7 says, when mother has visitors, she doesn't want us playing around, so she gives us the phone. Others also say that when we are given homework, we are told the homework is inside the phone. For you to see the impact of this, you must be consistent with the information.
Mhm.
Digital health awareness is not something you say once and say. It is not like HIV test. I tested you and now I don't come back. For where it has reached currently, it is something that has to be consistent. You will have to go back to that school and go back and go back, and maybe go back with advanced knowledge towards ending it, and provide solutions for these children. They want solutions. That is now the trickiest part of it. You tell us to leave this, and then we do what?
And so when they ask that question, what do you say?
I identified some of the games that are very common among children,
Mhm.
whether rich or poor, whether in background that is low or high background. I, I have small balls. I always
Mhm.
walk with them in my bags. I have that rope of
Yeah.
jumping and
Yeah.
crossing over. I always ask them, do we know the function of this? And they tell you clearly they know the function.
Mhm.
Only that nobody maybe giving that game's priority. So I introduced the games. That is the only best solution I can give, best at the moments that I visit. You cannot
Mhm.
tell them that at your free time read books. There are children that need mental break. And in schools that I have gone to, when I go during the games time, I get the children playing the games. They have balls. Some are crossing the ropes. They are jumping. They are playing hide and seek, the small ones. Until there is a school called Odongo Primary, which has introduced a program of dancing that is even done over the weekends
Mhm.
with the children around. Out of the awareness I have conducted, I have been able to meet 800 learners and 100 parents and guardians. With these meetings, we have done different sessions with different topics. From the assessment I did, I realized that these children needs different angles of messaging,
Mhm.
and that is where I came out with the posters. Though not enough, but they speaks. Like in the school, I pin like 3 copies, 4 copies, put on the wall. They see it like when they get to
Yeah.
school. I printed handouts for the parents, just a brochure of 2 pages, because I know most of the parents don't read. They do not have that time. And also, we also came out with the prevention and interventions that can lead to prevention measures, even if Mary doesn't go to school. What can be done to prevent children from excess use of internet? Peer-to-peer discussion among learners to share experiences and promote healthy decision making. These children knows what they should do. And I also realized the solution is with them. We realize that this may encourage other children giving their experience, what they want to do, don't get to access phone, what do others do? Then skill-based and psychological competency building activities. This includes giving maybe sports, playing other games. These are things that even teachers themselves are trained of telling the children. Maybe the last thing that I see will reduce this is the raising of awareness. Remember,
Mhm.
something can work for someone, but maybe for one person, they need a different angle to
Right.
approach it. Just on a quick note, I visited hospitals because I was curious about what happens to the infants. I initiated and coordinated a qualitative research with health services providers in Kisumu slums. I engaged the pedestrians, the counselors, nurses, clinical officers.
Mhm.
I explored in the research the impact of digital addiction on infants, and also from the perspective of health, what do they notice on the ongoing school children on the impact of digital health. Some of my findings, it was delayed language or development, disturbed sleep patterns for the children, reduced concentration on mother to child, and sometimes also we social withdrawal as children are bored. The infants, they are bored. So those are majorly the areas that I have worked in. For up to this far, what I can broadly say is that digital health is something that is assumed but serious. We really need to work broadly with other stakeholders to do the sensitization about digital health. It is not only on children.
I am staying right now in India at an ashram. So they're working with these young people who are from very, very, very poor families. And when they come here, they get a free education.
Mhm.
And it's also fascinating because there's a very strong spiritual education that they
Mhm.
are giving along with the regular academic education. And so one one of the things that came to mind is, do these children uh, have any moral guidance? Because the internet is not, lacking any moral guidance. Is that something that maybe can be included in the work you do with them? To really ask them to think about their values and what is the meaning of life and
Mhm. Yeah.
what is the meaning of being of service to others.
Mhm. I think that is very important. Besides internet, there is life the children will live or they live. So social life is very important, and I think it's something we can or they can get engaged in.
So, how to accomplish that, though, is a question.
So it is something that we can do if they organize for maybe once a week a lesson
Hmm.
about social life and engage a facilitator like maybe me or somebody else so that they can get to learn about different aspects of life.
Well, I love what you're doing, and I want to thank you so much for taking this time to tell me all of the marvelous work that you're engaged in. So keep up all the good work, and of course, we'll be in touch.
Thank you so much for considering me for the interview, and you have been my patron in this, and you brought up the idea, and you have always helped me to cultivate the idea into action, to be bought by other people's mind and to
Uh-huh.
convince other people that this is something that is possible. I really appreciate. Thank you so much.